Welcome to Restoring Memory, a COVID calls exploration of the first two COVID years. My name is Scott Gabriel Knowles. I'm a historian of disasters, and since March 16th, 2020, I've been the host of COVID Calls, a daily discussion of the pandemic with a diverse collection of disaster experts. This is episode number 489, March 16th, 2022, and the headline for this is Fighting for Health with Dr. Gabriel Bosslet. And let me bring him on. Dr. Gabriel Bosslet, let me introduce him. He's not a stranger to COVID calls, but let me introduce him anyway. Gabriel Bosslet is Associate Professor of Clinical Medicine at the Indiana University School of Medicine and is the Program Director for the Pulmonary and Critical Care Medicine Fellowship. Since the pandemic began, he has cared for COVID patients in the ICU and helped to deploy and educate critical care trainees through the two COVID surges in the state of Indiana, although I believe we're going to have to update that part of this bio. He also runs a COVID Facebook information page for the state of Indiana known as the Hoosier COVID Update that has become a community of over 40,000 followers. Gabriel Bosslet, thanks for joining me on COVID Calls.
Yeah, Scott, thanks for having me.
We talked last May 31st, 2021 on COVID Calls. We've kept up since then personally, but it's been how many pandemics have we had within the pandemic since then?
A lot.
We had Delta and Omicron since then.
Yep. And the worst for us was, Omicron was, the end of Delta, beginning of Omicron for us in Indiana was the worst. This past December, January was the worst, I think.
Can you talk a little bit about that time?
Yeah, it was, we had a surge in the fall. Late August, early September, that got pretty scary, and that calmed down and we thought it was behind us. And then in November, it just started going bonkers. And, the hospital I work at normally has an 18-bed intensive care unit. I've seen it at 20 patients before. And we were at 46 actually was the worst of it, 46 ICU patients, which is unheard of in that hospital. So you're talking about almost triple the amount of usual maximum patients. In Indiana, we got hit hard late mainly because we were a poorly vaccinated state. I think right now we have like 55% vaccinated, fully vaccinated, all people considered. So yeah, things ramped up quickly. We honestly, luckily, I say this, I don't mean to minimize Omicron, but Omicron is a different virus than Delta. And had we had the case rise with Delta that we had with Omicron, our hospitals would have been chaos, people in hallways. But Omicron it looked like it only hospitalized about a third of the patients per case in Indiana. And so we ramped up. It was very busy. I worked probably 30 plus straight days around the holidays. I missed my wife's family's holiday. And so that was rough. But, since then, it's just fallen rapidly. We went from full ICUs to now we're normal. The hospitals are totally normal now. It's crazy.
What did you notice in terms of, as we went into Delta and then Omicron, the way that the team worked together? I'm really interested in what was learned from sort of the first really harsh outbreak in 2020 and then into 2021, particularly after a period of time in which I think many Americans, the vaccine became available, things were better in summer for many people in 2021. I don't think doctors and nurses ever relax, but there did seem to be a sort of breathing out and looking around saying, okay, maybe we made it through this. And then it's a totally right back into things. So I'm really curious about what was learned and kind of muscle memory that came back with Delta and Omicron.
Well, we had a massive diastole last summer, where things were pretty normal. I can remember going to the grocery store without a mask last summer for a few weeks maybe. Um, and we did learn things, when it started to get bad and we saw that, in the United States kind of looks to Europe because Europe has always sort of been 2 to 3 weeks ahead of us. And so we knew things were coming. And so we did a better job, I think, this last time from an institutional administrative standpoint of getting ready. So our hospital hired locum tenens and brought them in, so extra doctors to care for patients. And we'd had a couple extra doctors from before that were already trained up and ready to go. They offered incentives for nurses to do more, to get more nurses in. So I felt like we were a little bit more prepared, from the standpoint of the physicians who were working. I'm the fellowship program director, and so there are 21 fellows who are under our, who we're training, and those are a really vulnerable group of folks because they're training, but they're really, for the most part, they can do all of the work. They're sort of just in a tutelage stage for 3 years, but they do it for a pittance. I mean, a resident's salary compared to their, what most of them owe in loans is not a big salary. I mean, it's not tiny. It's probably 50 or 60,000 a year, but it doesn't vary with their productivity, right? So the more patients you see, they don't get more money. And so I was very cognizant as a program director of not utilizing in this last wave, not utilizing the fellows for overage coverage for the ICUs, because when the faculty would work more, we would get paid more. And this is true. I mean, this wasn't unique to IU. This is kind of the way it works, but fellows and trainees are kind of on a salary that's fixed. And so I was very cognizant of not using them at the beginning, but it got to the point where literally everyone else was used. So I went to our hospital system and was like, look, we need more people. I can ask these folks, but I'm going to ask you to pay them extra for this time because they weren't planning on doing this and they need to be paid. And our hospital system, my hospital system, luckily was like, yes, we'll happily do that. So I got them some extra money. And we made it voluntary too. Like, it's not mandatory. You can do it, but you'll make some extra money. And so for a little while they did, but quickly that petered out. They didn't even want to do it for the extra money. It's just so exhausting. It's such exhausting work. So I think we were better prepared. We certainly knew how to care for COVID better. We're much better at, proning patients, putting them on their bellies, doing it quickly. And we're also, from an emotional standpoint, I think, when someone comes in with COVID and you put them on the ventilator, by now you're just sort of used to the fact that, it's sort of just almost a coin flip as to whether or not they're going to live or not. And I hate to say that you get used to that, but you sort of have to steel yourself for that. Early on we were like, let's try this and let's try this and let's try this. And we're still trying stuff, but, really very little has worked. And so now we're, I think just emotionally more prepared for the fact that, a reasonable percentage of those patients are going to die. And I think that's just a coping mechanism, frankly.
I hear some exhaustion in your voice. It would be strange if it wasn't there. And I want to ask you another part of that, and it has to do with the political context in which those patients coming in with Delta, and particularly with Omicron, the context of understanding that. And I want to be careful about this because I know a lot of people end up in the ICU with COVID who may have been vaccinated. I don't know if it's a lot, but there must be some. And many people have done everything that public health leaders told them to do and have still gotten Omicron and had terrible cases. So I'm talking about that subset of people who chose not to be vaccinated, have maybe been outspoken about it. And then, people were ending up in the ICU. A large percentage of them had not been vaccinated. And again, that's that's what's happening in the clinic. But of course, outside the walls of the hospital, the fall of 2021, COVID politics were, I think, just absolutely brutal in America. Well, how did that contribute to your exhaustion, or are you able to wall that off?
Yeah. I mean, yeah, I'm going to answer that. But before I do, I will say that the exhaustion, I am still exhausted, and I'm surprised by that because things now here are pretty normal. I mean, we have very few cases in the state. It's been, the hospitals for a month have been back to normal operating. And I haven't been in the ICU for the last month either. I've been on sort of administrative time. But I'm still very exhausted. I'll be honest. I'm a little surprised by how exhausted I still am. And I think it's just sort of 2 years of adrenaline has really just taken its toll. And so I hopefully that comes back. But okay, so the question at hand, so the politics. Yeah, so if you look back to 2020, early 2021, maybe the pandemic sucked, but and it was a political mess. But as an ICU physician, you could separate those two. One of the hardest parts of 2021, the surges in 2021 specifically, especially late 2021. So August, September, December, January, which were bad, was that there was this overwhelming and palpable sense that some of what we were doing was senseless, right? I mean, the people, by and large, in an intensive care unit of, let's say, 30 patients, in an intensive care unit, 16 of them would have COVID, and one of those would be vaccinated at all. A very small percentage. And so there was just this overwhelming feeling of it was absurd. I mean, it was an absurd feeling that we didn't have to be this way, I mean, and so the exhaustion of caring for those patients physically, it's exhausting. It's an exhausting disease to care for. You're flipping people over on their bellies, which you don't do that much normally. You're having to put on a ton of gear to go into the rooms. It's physically exhausting. It's emotionally exhausting because they die, but it's also emotionally exhausting because, especially in 2021, it didn't have to be that way. And the politics of it were very frustrating because there were leaders both nationally and on a state level in my state that came out and said they didn't believe the numbers, even as late as late 2021. And when I hear that kind of stuff, it really just makes me sad. What we need in times of crisis in our hospitals are leaders who support us and who empathize with the fact that people are dying and that we're struggling in the hospitals. And we did have leaders that were that way, but we had leaders that weren't too. And politically speaking, that was very difficult for me to swallow, to the point where I kind of joke that I was somewhat political before the pandemic, but the pandemic brought politics to my shop, right? I mean, before the pandemic, medicine was, I guess, political, maybe, I guess, but not in the ICU. But that stopped with the pandemic. Politics were in the ICU every day. And that changed me. That changed me forever. I am far more political now than I was before the pandemic. If someone did a sort of qualitative study of my Twitter feed starting in 2014, it would go from, mostly medical education stuff and some posts about my dog and my kids to basically tweets with exclamation points about the pandemic for a year and a half. And now it's mostly the disaster that is politics around public health and things that protect citizens in the state of Indiana. And
When you
that's
say,
because, yeah,
no, go ahead.
I was just going to say that's just because they came into my house. You know, that they came into the hospital. They came. You know, I didn't go seeking politics. Politics came and found me, and now I can't get away from it.
When you say that politics entered the ICU, you mean that literally in the sense of why the patients were there, and they're not speaking to you when they're in the ICU. They're too sick to.
Some of them are.
Really?
Some of them are, yeah, and some of them say political things in the ICU. Yeah, I mean, I was on this weekend and had a patient who could speak to me who doesn't believe in COVID.
Walk me through that conversation. I mean, how does that work even?
I didn't have the conversation with them. I was told that. And Scott, and so that's probably hypocritical for me to say, but I'll say this, that my exhaustion is such that, 6 months ago, those were conversations I was happy to engage in. And at this point, I ask about vaccination. I ask if they'd like to talk about it. And if they say no, the conversation's done. Whereas before, my next question would have been, can you say more about why you don't want to talk about it? I'm just not interested. I'm exhausted of it. So I, in all honesty, I didn't talk to him about it because I just, it sort of eats away at my soul anymore to have those conversations.
I mean, I just want to sit with this for 1 second. So if a person says to me, if a person comes into my classroom and they sit there and I say, okay, here's the syllabus, and they say, no, I'm here for a sandwich. My reaction to them would be, well, I mean, I'm still going to teach the class. And if you're here, you're welcome to it, but I don't serve sandwiches. I mean, you're here for a different reason. I mean, there's just a fundamental miscommunication there. And I'd be worried about them, honestly. I mean, beyond this sort of like, why are you here? I mean, and it's an imperfect analogy because I don't save lives, but I mean, what I'm trying to get at is it does feel that there's mental illness there.
People have it's not a huge percentage, but a reasonable percentage of the American population have chosen to believe a fiction. And and what's more frustrating is a reasonable percentage of the leaders of the American population have chosen to help them believe that fiction. And yeah, that is where we are. It's not a huge percentage. I don't want you to come out thinking that I have conversations every day with people who don't believe in COVID. People at this point, for the most part, do, but they still exist. And there are a reasonable amount of people who believe that it exists and still aren't getting vaccinated. I know a lot of those.
Right.
And yeah, people have chosen to believe a fiction. People have chosen to believe multiple fictions. I mean, it's not just COVID. I mean, there are a lot of fictions going around in the United States about, a lot of stuff. January 6th, the election, all of that's all wrapped up together. I mean, it's all part of the same narrative, frankly.
Let me just take a moment to remind everyone that I'm talking to Dr. Gabriel Bosslet today. I'm really happy to have him back on COVID Calls, particularly as we're moving towards the 500th episode and the launch of the digital archive. And let's just stick with the politics for a second, because you really did get involved in the sense that you went before the state legislature and spoke your mind. And in December, I guess in what must have been almost the apex of the Omicron wave, there was a bill to, if I understood it correctly, ban vaccine mandates in private establishments in the state. So the legislature was going to interpose itself there between customers or institutions and private institutions. And you went to the floor and spoke about it.
Yeah, I did. It was December 16th. It was a very hostile. It was on the floor of the state house, of the state of the House of Representatives in the state of Indiana. I was one of 4 physicians who spoke. Me, the president of the Indiana State Medical Association, or former president maybe, and then 2 physicians who spoke spoke on behalf of the bill, supporting the bill, who are widely seen as relatively disreputable anti-vaccine physicians. So I was disappointed at the turnout. The rest of the room was very hostile. It was, there were 2 people or maybe 4 people in masks in the entire room. There were probably 150, 200 people in there, and people were not nice. I went and spoke. The bill was exactly what you outlined. It was a bill to outlaw businesses from requiring vaccines of their employees. That bill passed the House and Senate in a very watered down version that basically was a shell of itself, which is kind of what this entire session in the Indiana State House was a lot of sort of right-wing chest thumping bills, and then they would pass a bill that was kind of just a small bark. So this bill said that businesses must follow federal laws in regards to vaccine mandates, which is a pointless bill. Like, they have to follow those laws anyways. So I'm happy in that. I do think that, I like to think that part of that my testimony helped to sort of move the legislature to something more reasonable, and this is the way it's supposed to work. So I don't want to, I'm happy that the Republican supermajority legislature decided to water that bill down. I'm thankful to them for doing that. But yeah, I went and spoke at that bill. I spoke to legislators multiple times in multiple venues regarding that bill and multiple other bills, and I've tweeted a lot about bills in the Indiana session this year, more so than ever, because my eyes have sort of been open to the fact that, especially now in American politics, most of the power is in the state houses, and people don't know that. The Congress and the United States Senate gets a lot of the press, but most of the things that affect the daily lives of Hoosiers and of other citizens in the United States and other states, those things are decided at the state house level. And so my interest has become very much so in state level politics in the state of Indiana, a state that has a Republican supermajority because of massive gerrymandering of the way the maps are drawn. So yeah, I've become radicalized, frankly, and I don't know if that will change. I don't know if I'm going to go back to sort of the quiet political consumer that I was before. I don't think that I have that in me.
I have never given testimony before a legislative body before. I have no problem talking before a crowd. I love it. If there's an energized crowd, I feed on it. I enjoy, communicating about the work that I do. Obviously, I enjoy talking to brilliant experts like yourself. I get a little antsy when I think about getting in front of a legislative body and speaking, answering questions. How did you prepare yourself for that?
Yeah, so I had no idea what it was going to be like. I had testified, or I'd been to testimony. I don't think I'd testified, but I'd been to a testimony at a committee hearing years before. My sons actually testified. They had peanut allergies and testified for an stock epinephrine bill. So I knew kind of what it was like. It's funny because I had the whole premise of my appearance there was that I had drafted a letter and sent it around just by word of mouth to physicians in the state of Indiana that basically said, here's why we should oppose House Bill 1001. And I drafted it with some colleagues of mine who had done some kind of, we call it good trouble, earlier in the pandemic, trying to sort of, get people to understand what was going on. So we drafted this letter. We passed it around, and about 500, and I don't know how many, over 600, I think, Hoosier physicians signed it at this point, which is a lot. I mean, for a word of mouth thing. And so the whole premise was I delivered the letter. I sent it to all the senators on the committee the day before. And the email that I sent to them said, hey, I'm going to bring this letter and I'm going to read it into the record tomorrow. And, I'm happy to chat. Well, I got an email reply from one of the Republican senators. And he said, listen, let me give you a piece of advice. He said, don't read the letter. He said, we can all read. He said, just come with and speak from your heart about what you want to say. He said, we have the letter. So if you read it, it's going to be boring. And man, he was right. Because, what I did was I wrote down on a little card, four or five different points I wanted to make. And I sat there for probably an hour and a half and listened to testimony, and literally the entire testimony for that hour and a half. This is an 8-hour session. The hour and a half before me, or it was probably longer than that. It was probably 2.5 hours, was all anti-vaccine rhetoric. I mean, clearly groups of anti-vaccine people. I think every anti-vaccine activist in the state was there and spoke. And so, there was literally no one that spoke against this bill until the physician in front of me got up to speak. And in fact, one of the lobbyists for the State Medical Association grabbed me, and there were 4 physicians there to speak. He grabbed the 4 of us and pulled us out and said, hey, listen, it's getting kind of heated back here in the back. There was a fight in the hallway and people are asking for your names. And I want to let you be aware of this so that if, it's getting a little heated. And if you want to go, I will understand. Well, 2 of them bolted. And I was like, no, man, I'm definitely speaking. Like I'm in it to win it here. And so I got up there, and if you watch the testimony, I was damn nervous. I mean, look, Scott, I give a lot of talks. I'm an educator. I give talks in front of groups of physicians all the time. I can handle a room relatively well, but this was one I hadn't experienced before. This was an openly hostile room. And I just kind of took a deep breath and just started going. And I've watched it a couple times, and I spoke, that advice that Republican senator gave me to speak from the heart was perfect, because that's what I did. And I think it came across. And so, I learned a lot in sort of, I'm good at speaking off the cuff. I'd rather speak off the cuff than from prepared remarks. And I'm glad he gave me that advice, because I think I would have read this letter and it would have been a boring nothing burger. And it wound up being, I think, better.
Well, I mean, it really, if I hadn't known you before that, I would have been reaching out to you immediately, in part because it was a defining moment in Omicron. And actually you got pulled into, you kind of leveled up from a media perspective, from a person who has a large community that you've worked with to provide information on Facebook, and then your Twitter presence, in which you do. I mean, it's great. You're a great follow, because you do talk about running, and you talk about your dogs and your family, and then you come in and kick ass a little bit with some ideas about what's going on with the pandemic. But then you got invited to go on Rachel Maddow, and I mean, that's a megaphone.
Yeah,
And
that was, yeah.
Talk about that a little bit.
Yeah, that was neat. I mean, look, I never, I never wanted that megaphone. That's for darn sure. And I never, that was that was a cool experience. Let's just say that. When I got the call from the producer to do that, I thought it was a joke to begin with. And then when I went on, I had a good conversation with Rachel. It was a really neat experience. And I was surprised because number one, she gave me more time than I expected. And number two, she played a good portion of my speech on the House floor. Actually, she probably played, I don't know how much it was, a minute, 2 minutes. I don't know. But it was like, I remember being like, wow, she's playing a lot of this piece. And yeah, I mean, I sort of channeled the advice that senator gave me again. I mean, that was very formative for me. I won't forget that. And I just sort of spoke from the heart. I had no idea what she was going to ask me. They don't give you the questions ahead of time. You just kind of wing it. And so, yeah, that was super cool. That actually, interestingly, so I was really excited about that. I got home and I got the phone call around 4:30 or 5, and I have kids. I have teenage kids and my wife, and that same day, this is kind of embarrassing, but that same day, Ariana Grande had shared one of my tweets in one of her Instagram stories, which, and so my phone lit up at like right around the time I got the phone call from Rachel Maddow. My kids started like calling and texting me, "Oh my God, Dad!" And I didn't know, I didn't know. I had no idea what. I didn't honestly, and I'm kind of a little embarrassed, but I had to like Google who Ariana Grande was. That's just not my style of music, and but my kids thought that the Ariana Grande thing was far cooler than the Rachel Maddow thing. Uh, but I was geeking out about the Rachel Maddow thing. So yeah, that was a really coul experience.
Um, well, thank you for sharing that. And of course, I love stories where you break through to become cool to your kids.
Yeah.
I mean, it wouldn't matter how many books I wrote. Actually, my kids are great and they're very supportive. But yeah, a breakthrough moment like that where you're actually cool in their eyes, notch
Yeah.
that one, dude, because most of us never get that. Way to
It's
go.
over. It's way over, but
It's fine. And I raised the Rachel Maddow thing. It's not so much. I mean, I thought the segment was excellent, and I thought it felt like you had prepared a lot. But I think it's also that you're quite used. You're a good communicator, and you're quite used to talking about your values, and explaining the context of this thing. But I come back to this idea that document, the letter and the video, are important ones in an ongoing series of moments throughout this pandemic globally, but here in the United States context, where we've just relied upon people who have moral authority to cut through everything else and sort of be clear for a minute and just remind people exactly what's happening. And I guess within that context, I just want to ask you, man, like, what was your main point to the legislature?
my main point to the legislature was putting a bill in writing that de-emphasized the importance of vaccines at a time when, frankly, we should have been debating a bill that mandated vaccines for everyone, not a bill that outlawed mandates for anyone, was ludicrous. And it was leadership malpractice, frankly. I mean, that I didn't say those words. I think that would have been insulting and would have sullied my message. But the underlying theme, but the underlying feelings behind my going there was that rather than debating not allowing anyone to mandate vaccines, we ought to be doing the exact opposite. And so what was I asking them to do? And I said this on Rachel Maddow. I was asking them to do nothing, right? Like just put your hands behind your back and zip your lips and do nothing, and you will do better than this. So yeah, and if that came through as I could, and the funny part is like you use the words moral authority when you sort of just frame that question, and to me that's an absurd way to think about it. No, that's not true. That came out wrong. It's absurd that those words are the moral authority because they were so self-evident to me.
Right.
I mean, it was. I didn't say anything profound. All I said was what literally every physician and public health person had been screaming for months. It's just I guess I had the stage in the moment where I don't know why it was the way it was. I guess it was just the moment, I guess. But it didn't seem like anything very profound to me, and it still doesn't.
The moral authority, in the way that I understand it, comes from your saving lives with teams of colleagues and having been through the worst pandemic in American history in a century. And I think it's a testament to the weird times, the fractured times in which we live. I mean, look, it's a democracy, so there's always going to be debate, and even people who, like doctors and nurses and people who save lives, there's only going to be questions. But this has been a particular time of diminishing expertise and disinformation, and I think that's what I'm trying to get at, is that this still was a moment where you kind of cut through, and I think reiterated that, not in a preachy way, but you got up there and said, look, we're the ones who know. We're worn out. Please don't make it harder on us. And it's you said, it should be a simple message, but that moment, it was a galvanizing moment.
I guess. Being inside my own head, I suppose so. It just comes from a place of such frustration, like no one's listening. I mean, and that was also, remember, December 16th was cases were ramping up rapidly. Hospitals were filling rapidly. I mean, we were desperate at that point. We were in dire straits, and again, it was all a timing thing too. Like, had that committee hearing been today, I don't know that I would have had the passion and the real drive to go do that, because we are in a different moment today here. I'd like to think that I would, but I'm not so sure. I mean, I think a lot of that was frustration from the fact that, that was that came at the end of like a month of being in an ICU. And I was exhausted. So yeah, I mean, those sorts of moments, I'm immersed in COVID data on a daily basis with the Hoosier COVID update page. And so if anyone asks me questions about COVID and we've spoken before, I could talk about it I could tell you how many cases were in the state of Indiana today, approximately at least. And so putting me in front of a group and giving me and having me be probably a little sleep deprived and emotional, you're going to get something like what you saw, I guess.
I talked to Greg Gonzalez yesterday, public health researcher.
Yeah.
He's an amazing person and great, inspiring life story, and an activist. Started as an activist who then had to become a scientist to do his activism well, HIV/AIDS activism. He said something really amazing to me. He said, he used this phrase, I'm not going to get exactly right, but it's something about coming out of activist retirement. That he had sort of got himself into a public health school now, where he's doing, public health research and working in big teams. But I asked him how COVID had changed him, and he used this phrase, coming out of activist retirement. And I bring that to you because you used the word radicalized a minute ago, and so I feel like what you've described your trajectory is to come from position of kind of mainstream medical practice and teaching. But now the politics are central. The political context is central to how you communicate, how you position yourself. I mean, again, in front of the state legislature, standing there, that's activism. And so I guess I want to just ask you, about this again. I mean, is there any going back?
No. I suspect the trajectory of my career is probably forever on a different path. I'll still be a doctor for sure. I'm still going to be doctoring, but whereas before I never envisioned myself being active politically, either on the stage or behind or in the or backstage. I don't see that I can avoid that at this point. I mean, the thing that I realized was that, I mean, politics has its tentacles in everything, at literally everything we do. And the people who are elected to lead us wield a lot of power over our daily lives. You know, I could give you tons of examples just from the Indiana State House from the session this year, which just ended, of bills that are going to affect our daily life in the state of Indiana. And had the pandemic not happened, I don't think that I would be in this position. And at the same time, the problem is now for me, I can't put that back, right? I mean, the box has been opened, and the cat, I'm going to use a bunch of different terrible metaphors here. The cat's out of the bag, and I can't put it back in. I can't just ignore that now. The sense of injustice is just, it reeks, and it's in everything. And if I'm the type of person who needs to try to make things better. And so that in some way, shape, or form, I'll be involved in the state of Indiana in trying to make things better.
Your sense of justice and injustice come from religious beliefs? It comes from your training as a physician? It comes from a sort of commitment to an understanding of democracy? Help me understand what your orientation around justice is rooted in.
I don't know. I mean, I think anything that I would tell you would probably not do it justice. I'm like a pathologically honest person. And, I can't lay my head on the pillow at night if I haven't sort of, been the type of person that would allow me to lay my head on the pillow at night. I just don't work that way. And, I was a philosophy minor in undergrad. I got a philosophy master's when I was a fellow. So there's a lot of sort of cognitive work behind that, but that's not where that comes from. That comes from something in my childhood, I would imagine, and I don't know what it is. But I have a very strong sense of fairness and justice.
Thanks for taking that question, and I didn't prepare you for it. But I've been with a group of colleagues. We've just founded an organization called Disaster Researchers for Justice because we were unsatisfied with the presumed objectivity of disaster research and social science in general, which seeks to treat the world as an object of study, as if the observer is somehow not in that world. And I'm simplifying here. And we're building, of course, on the shoulders of giants of disaster researchers who are hugely socially committed, not in a partisan way, left or right, but that they have a commitment to trying to show the conditions of injustice that create disasters and that spring from disasters. But they're not well represented in media. They're not well represented in testimony before state legislatures. We've trying to make ourselves visible. I mean, I'm playing a minor role. There's others who are leading here. But it's been on my mind a lot because this organization my involvement with it would not have happened without COVID.
Well, so then we're in the same boat. Right?
I think so.
I mean, I think that, that's a very analogous situation to mine. I wouldn't be on here if it weren't for COVID. I wouldn't have, none of this would have happened if I would have been COVID. I would have been an anonymous ICU physician somewhere in Indianapolis, actually.
So we're almost out of time. I know you have a big day tomorrow, and it's probably been a long day for you today. And I, as always, appreciate your real generosity with time. And I guess the last thing I want to ask you actually comes back to kind of where we started. You were talking about the young doctors. in the ICU and your moves on their behalf to get them paid fairly. So you're a teacher. In the middle of all this, you're still teaching. I can only imagine what it's like to be a medical student or a nursing student. I talked with Cassie Alexander yesterday, a nurse who wrote the book You're the Nurse, and she was talking about nurses who had only ever known COVID. They came out of school, and that's the world they came into, similar to what you're describing. Do you think that what do you think about that? And do you think that this moment is going to be somehow energizing to this young generation of healthcare workers, that they will come through it and be inspired is the wrong word, but somehow, I mean, they're going to see it. They've seen a lot of stuff in the last 24 months that's only been in history books. So I'm trying to gauge how this young generation is coping with this time.
I don't know. I don't know that we're going to know until it's behind us. I mean, the analogous sort of group that I talk about when I talk about this generation of training physicians is the greatest generation, and sort of the GI generation from World War II. Had you asked someone, a general in World War II, how do you think this group of kids is going to come out of this, and what do you think they're going to be like? I don't think they could have said that they were going to be seen as the greatest generation, and that they were going to do all the things that they did. I think there's a chance, though. I mean, certainly I can tell you this: the generation of humans that are finishing their pulmonary and critical care fellowship in 2022 and 2023 will be some of the best trained intensive care unit doctors we've ever had. I mean, they will have had more at bats with sick patients than any previous classes. Now, whether that makes them prideful and are proud and sort of with a sense of duty toward the profession, or whether it's just burnt them out, which I think is possible, I don't know. And I don't think we'll know for another decade at least. I hope it's the former. I suspect it will depend a little bit on the generals that they had leading them into this battle, the program directors like me, and whether or not we did a good job of, making the experience one that was fruitful and not harmful. And I don't know if I've done that either, and won't for quite a while. I hope those that we've ushered through this time turn out to be sort of the proud ones, but I have no idea. We'll see.
Let me just remind folks, you've been listening to COVID Calls, and you've been listening to a special episode in the group of episodes called Restoring Memory, as we're leading up to the 500th episode of COVID Calls and the launch of our digital archive. I want to remind folks there are more COVID Calls episodes coming, and today marks the 2-year anniversary, and we have episodes all day tomorrow as well. Please join me at 8 a.m. March 17th, 8 a.m. Eastern Time, for a discussion of the COVID Historical Archive with Valerie Marlowe, Ellen Noonan, and Adriana Link. It's going to be a great conversation. I'll see you for that. And I want to thank my guest, Gabriel Bosslet, for his time. Always enjoy speaking with you, learning from you. You're an inspiration. I don't know what else to say. And I think this call really clarified some issues for me that I've been wanting to ask you about. So thanks for taking time.
Thanks, Scott. I love talking to you too as well. It's just an absolute pleasure.
Stay healthy, everybody, and we will see you next time on COVID Calls.